All right. I think we might still have some people joining us from breakout rooms, but we're going to keep things moving and get started with our next session. This is a really exciting panel discussion with Dr. Muzquiz and Dr. Acosta. We're very excited to have them speaking today on the topic of addressing anti-DEI legislation. What are the steps that we can take moving forward? And what is the impact on the communities that we serve? So I'm going to just go ahead and turn it over to Dr. Muzquiz to go ahead and get us started here.
Great, thank you, Izzy. Hello, everybody. Kisik Kukit. I am LeeAnna Muzquiz. I am Salish and Kootenai from the Flathead Indian Reservation in the northwestern part of Montana. I am a family physician. I work and have worked for my tribal community for over 20 years as a family doc. I also have the privilege of serving as the Associate Dean for Admissions at the University of Washington School of Medicine. I oversee the admissions process for the 5-state regional medical school known as WWAMI across the northwest part of the country. So this topic is sort of near and dear and impacts my daily life. And so I'm really thrilled to be able to partner with a friend and colleague, Dr. David Acosta, who will be presenting with me. And we're sort of looking to have a bit of a conversation today. So our purpose is really to talk about the anti-DEA legislation that we've been hearing about a little bit based in the SCOTUS decision from last July, how it impacts our Indigenous communities, particularly in healthcare workforce program development and those sorts of things. So it is, as I said, my privilege to be sort of here today with Dr. David Acosta, who is the Chief Diversity and Inclusion Officer at the AAMC. And he does a lot of work with activities across medical education community and leads the association's Equity, Diversity, and Inclusion Unit. I will allow Dr. Acosta to provide the rest of his introduction himself. He has some data and some information to share with us today in terms of what the landscape sort of looks like. And then we'll come back together and he and I will have a bit of a conversation. We've prepared a little bit about some questions that we think are relevant to you all and to this work. And then we'll hopefully have a little bit of time at the end for Q&A. So good afternoon, David. It's nice to see you, and I'm going to let you have the stage.
Thanks, LeeAnna. Really appreciate it. I'm so excited to present with you. And again, thanking everybody for just this opportunity to spend some time with you to talk about something that's affecting all of our lives right now, without a doubt. And I think in order to basically, as all the work that we do, it's important for all of us to develop that knowledge foundation that we need and then begin working with each other to find out how can we collectively begin addressing the landscape that's out there as well. So I'm going to get started by sharing my screen with you. I think my hope today is to go ahead and begin thinking about really kind of catalyzing your thought process. And LeeAnna and I thought what would be very important for us is to basically think about, number one, let's create a little bit of a framework around our discussion in Q&As, I think, as we kind of begin getting busy with this as well. So let me go ahead and change this to that particular screen. I hope everybody can see the slides. LeeAnna, can you see the slides? Great, thank you for that. So I thought what I'd get started with is, again, I'm a guy who likes quotes as well. And for those of you who don't know me, I'm a family physician by training as well. Spent some time at the University of Washington, where I met LeeAnna, and we worked together on admissions and trying to increase, again, the number of Indigenous people that were going to be admitted to the School of Medicine in our 5-state region that we took a look at as well. So I still carry that with me and my soul and my heart. That really drives a lot of the work that Norma Pohl, myself, and our team also work on very hard with that. And I thought I'd start the session with one first quote that came from actually Miguel Cardona, who's the U.S. Secretary of Education. They published in September of 2023 a monograph that basically is entitled Strategies for Increasing Diversity and Opportunity in Higher Education. This is one of those resources that I think is really important that if you haven't seen it and haven't read it, um, put it on your shelf to begin looking at, because there's a lot of good information and a lot of hope that comes from it. When our U.S. Secretary of Education basically made a comment with regards to that, it's so important, why we need to continue to be vigilant in this particular work despite the landscape of what's going on. And just allow me to read the quote that really moved me, I think, that kind of gave me some bridge of hope as well. And he said, quote, colleges and universities may have lost a vital tool for creating vibrant, diverse campus communities, but this report makes clear that they need not and must not lose their commitment to equal opportunity and student body diversity. Our country's future depends on it. This particular monograph came after the post-SCOTUS decision, and I think it was really apropos, but again, gave me a little bit of hope, and it should give us all hope that the Department of Education is really supporting us and behind us in the work that we do today. So really, the work of this session, I think the AAMC and other organizations as well, this is not about only understanding what this new anti-DEI legislation on top of the post-SCOTUS decision says, but also hoping to move us to get to this point of saying we have to stay this course and we can't give up, as others are expecting us to do. And we really shouldn't waver from our intentions, our initial intentions, the focus on getting more indigenous people into the healthcare workforce as well, and also the work ahead that we have to do. And we have to collectively do this together, because I think we have to do this. We have to weather the storm, not individually. We have to do it collectively as well with each other. As I mentioned, I love quotes. And when I read this from the president of the American Indian College Fund, it really moved me, and hopefully will set the tone, I think, for this session as we begin discussing this a little bit later on. But the one that really struck me are these two. And one is, our students belong where they dream to be. I love this sentence so much, so I'll read it again. Our students belong where they dream to be. They are worthy, and they deserve to achieve their potential. We all depend upon their brilliance to lead and innovate today and in the future. And the same in this message from her, Cheryl Crazybull. The message was also pretty clear. This came out also after the post-SCOTUS decision was made. And she also reminded us that education was and still is the answer to empowering people to envision and creating a future of their choosing as well. So with that in mind, I hope that creates kind of the tone of where we need to be as well. And so really briefly, what we're going to do is we're going to cover the current status of the state anti-DEI laws that are in place and ones that have been proposed, but also discuss what the potential impact are for these laws, because it's still a little early to understand what that impact is. But all of us in doing this work can anticipate what may be in place, and we have to basically follow weather the storm to kind of see what happens. And then I want to focus on undergraduate medical education, graduate medical education, and the faculty that belong in both of those worlds as well. It doesn't mean that the other health professions aren't important, because they are. And my hope is what I say today. I want those of you that are from the other health professions to also think in the light of, this type of things that I'm going to present to you, how it will affect also your particular health profession as well. My hope is that during our Q&A, we can answer some questions, but also kind of really explore what role do you play in addressing this current climate and landscape as well. So I'm going to introduce you to a couple of things that I think all of us that are doing this work need to pay attention to, because we have to pay attention to what's out there in order to be up there. And things are changing at light speed. And so, again, one of the biggest helpful resources that I have found and that we use pretty frequently is this one. And some of you in the audience may already know about this as well. And I just want to validate your choice of using this particular DEI legislation tracker. For those of you who haven't seen it, I have the URL down below. But simply, if you just Google DEI legislation tracker, it'll take you right to this particular resource that was developed by the Chronicle of Higher Education. It is free, but you have to sign up for it to receive some of their newsletters as well, and the updates that you'll get from this tracker. And this particular tracker has a number of wonderful things that really goes over each of the states and every one of the single bills that have been proposed, and also those that have been in the state. Again, this is the general map that they'll provide for you as well. And just to kind of give you a little orientation, and I'll take a deeper dive on this so you understand what these mean, is that when you see the particular states that are in gray, That means that no bill has been proposed or introduced, or no legislation has been introduced. Those in the very, very light green basically say that some proposed anti-DEI legislation have been proposed in those particular states. Those with the darker shade of green, such as the one in KS or Kansas, says that final legislation approval has been done. But more importantly, those that have been in dark green are the ones that have been actually signed into law. Those in brown, which sometimes we don't pay attention to, but we must, basically are the ones where these particular legislation proposals have been either tabled or they failed to pass or they were vetoed by the governor. That was there as well. Now, what does this mean? And let's really translate this so I can put into words what this map actually means. And so when you go to this site, they frequently update you. The last update was on April 26th of this year as well. And so just kind of in general, what you need to know is that 85 bills in 28 states and 2 in the US Congress have been introduced since 2023. 14 of those proposals have final legislation approval, and 13 have gone on to be signed into law in the states that I cite there: Alabama, Florida, Idaho, Indiana, North Carolina, North Dakota, Tennessee, Texas, Utah, and Wyoming. And that maybe seem really overwhelming, but let me dive into it a little bit deeper in just a second. There's one particular governor in Oklahoma that actually issued an executive order that will take place in May, at the end of this month, on May 31st as well, that not only prohibits the use of state funds to support any DEI programs and efforts, but also they can't use property of the school or even resources towards any DEI initiatives, including Indigenous programs that are there, and orders the dismissal of what he calls non-critical personnel, specifically stating DEI staff as well. And again, as I said, 41 of these particular proposals have been tabled. They failed to pass. They've been vetoed. But all these proposals are not the same, and that's really important for us to understand. There are some that are a little bit more powerful, but all of them do not ban or essentially try to get rid of DEI officers and staff. But there's 4 significant areas that you need to understand of what these things cover. And again, this comes out really nicely in the legislation tracker as well, and these graphics are from that. So they cover these 4 areas. They cover mandatory DEI training. They cover diversity statements. They cover identity-based preferences for hiring and admissions. And they cover DEI offices and staff. And that's really important to kind of keep in mind because they're all not the same. So when I say that they've been put into law, that doesn't mean that every one of them is banning DEI offices and staff. So it's really important to look at that. So we take a deeper dive, and you're going to have a copy of all these particular slides if you haven't gotten it yet, because there's a lot of material here, and I'm not going to go through every state, but we've created a graphic, a table for you that basically lists the state itself along with the bill that has been mentioned and the number of that particular bill. And this is all in this DEI legislation tracker. The date that it was introduced, and I'm only going to concentrate today on those that have been introduced since January 1 of 24, because this has been going on since about 23 as well. But they cover, these are the 4 areas that you see on top that I just mentioned. And the X's in each of these particular columns basically stands for what did that proposal of that particular law include in it. And as you kind of skim down this list, and this is the first states from Alabama down to Missouri, of what has been passed. If the state is not listed there, that means the state has not had issued any of those bills. And just to orientate you a little bit better as well, the ones that I've highlighted in yellow, I did that because they basically now are issuing bans or restrictions in all 4 areas. And if you notice this, not every state has done that as well. We'll get to that in just a little second. And this is from the continuing. Missouri has had a lot of these proposals there. Not a lot of them have been passed at all the way down to Wyoming that you can see for yourself. And you see in Oklahoma, South Carolina, Tennessee, Utah, and West Virginia, they are proposed a ban for all these particular 4 areas that are there as well, too. So bottom line is this: which ones are actually stated into law? And so when you look at this on the state on the left, you have to ask yourself, do you belong to this particular state? And what do you need to know about this? Because the DEI tracker, once you get into that state, they'll tell you exactly what the bill actually says, and they've interpreted all that legalese to something that you can understand a little bit better, which is really helpful, I think. And so the ones that I'm concerned mostly about, there are 5 states that basically have banned DEI offices any DEI programs and initiatives and essentially funding, but also staff in those areas that are listed there. And those are Alabama, Florida, Texas, recently Utah, and also Wyoming as well. And so how does this affect essentially tribal colleges and the students that we're interested in and trying to get into medical school as well? So a wonderful resource, American Indian Higher Education Consortium, has a nice map that lists all the particular states that have tribal colleges and universities, and those are in a little bit of the darker green that you see. And they're listed there for you. I'm not going to go through each one of these, but this is a nice reference to begin using about that. But I'm also going to basically bring up the point of there are some, if you see the lighter green, blue types of states that are there, those are states where our Indigenous students attend TCUs as well. And so those are important because as we start thinking about these laws, again, are any of the laws that are in any of these states going to prohibit any of these Indigenous students from going and attending some of these tribal colleges as well? And as you can see from the list there as well, that tends to be Oregon, Nevada, Utah, Nebraska, Texas, Mississippi, Alabama, Florida, North Carolina, and also the northeastern states as New York, Connecticut, Rhode Island, Massachusetts, and Maine as well. So the thing I want to say about this is that what's really difficult is that sometimes there's not as many specifics in the bills that you would hope for to really delineate those. And that's why it's really important for us to really understand, in some of these states, these laws may potentially impact tribal colleges, but it really depends on a number of things. The state itself, because these do vary via the states that I just showed you in that particular table. But number two, it really depends on the specific wording or the language that is used in that bill with regards to, is it going to basically not only apply to tribal colleges, but I think about in medical schools, some of the programs that are in our medical schools that really address Indigenous peoples and the issues and concerns and trying to get them to support them in through medical school as well. So it's really about also depending on that scope of that legislation, which is so important to know. But with that in mind, again, we all know that tribal colleges operate under the sovereignty of Native American tribes and are governed by tribal laws and regulations. And in addition, we know that all the tribal colleges and universities also have their unique policies and practices regarding any work around diversity, equity, and inclusion that are influenced by broader legal principles as well. So with that, I think what's really important for all of us is that, is we need to consult legal expertise that are familiar, and this is important, familiar with tribal law for the guidance as these DEI legislation laws come out. And I can tell you by all the medical schools that we're in, we all have legal counsels. They don't necessarily have, again, expertise in the tribal law. And so, as I'll say in another slide that's coming up, it's really important for this. If you don't have that, again, just much like physicians, and if I diagnose a particular condition in you, if I diagnose cancer in you, it's not uncommon that I'm going to encourage my patients to seek a second opinion about what needs to be done. And in like that same fashion, if I use that as kind of a metaphor, it'd be the same thing. If you don't have people who have legal expertise within your institution, you have every right to seek legal expertise outside of your institution, especially with those that may have a lot of know-how and expertise around tribal law as well. And the last point I'll say along this line as well is that students need to be encouraged along with their pre-health advisors. And this is where the role of our pre-health advisors in the medical schools as well, and our health advisors during the time when the students are in medical, is they need to research those admission policies at the medical schools that they're interested in to find out how are they dealing with particular programs that they're interested in at the medical school that are going to support them and help them thrive as well. So again, I think the important pieces about this is making sure that there's an investigation going on and more information is there, because it may also affect a threat that student may want to apply to medical school as well. But I'll list it down below. In some of those states, we know that Wyoming's got this ban on DEI offices. But I got to tell you one thing that really excites me. President Seidel at the University of Wyoming said, university-wide, we know we have this particular ban and that the state is not going to fund our DEI officers. But he came out not too long, about 2 or 3 weeks ago, saying, but we will find funding to continue our practices in DEI because they're important and we've come a long way with that. And we'll just, if the state's not going to help us pay for these particular programs, we'll find a way to do that. And again, I think we need more presidents like President Seidel to really profile his courage to really to get beyond some of the limitations that these laws are happening. So here's my take-home message for this particular part, this particular segment in it, that I hope, again, get you a little bit more thinking about this. And number one is that what I've learned in being and working in 2 states that have anti-affirmative action laws in place is that I found so much, and still see today, even after the post-SCOTUS decision and with these anti-DEI laws, that a lot of people will overinterpret the law. So my take-home message for you is try to understand what that law actually states, but probably even more important, what that law doesn't address or doesn't state as well. There are a lot of people out there that are, again, naysayers to DEI and why we have that. But the important piece is that, again, for us, in order to basically create that narrative for this, we need to really understand what it says and what it doesn't say as well. And as I said before, I think the important piece is that, sometimes our institutional legal counsel can help us interpret some of the legalese in some of these laws, but sometimes they may not, and we may have to look outside of our institutions to be able to do that. And the last piece, if you're in a particular state that has begun banning this, much like what we did in California and Washington as well, we may have to require us to really develop new models for financing DEI, much like University of Wyoming is going to do as well, and not rely on the usual suspects that we depend on to do that, if the state is not going to be as prohibiting state schools, public schools from funding this as well. But we also may have to think about new ways in delivering DEI and what that really means as well. The last thing on the right-hand side of your screen, you'll see this UT system SB 17 working guidance. One of the other things is that we can't assume that everybody knows how to work within the law. And one of the things that I liked about this particular document, this is available publicly as well, that they really spelled out for everybody, faculty, students, anybody that this was going to affect, really, how do you work within the particular law like SB 17, and how do you put it in things that we are responsible for, the work that we do, and how do you put it in plain English that we'll really understand that we're still working within the law and we're not trying to break that law. And so I think that we need to do more of that as the states come on as well. So let's just dive into really briefly about what are some of the anticipated impacts or potential impacts for undergraduate medical education. As I said, this may apply to other health professions as well. But I think those of you in the audience that are pre-health advisors, this is something where I think it's best to be prepared and more proactive than to wait for it to happen. And a couple of things that I think are really important to this know. And I think it's really important to know about, what are some of the good practices that some people are already practicing, that are already impacted by this law already. So one of the anticipated impacts is on admissions. And as LeeAnna talked about, she's really concerned about this because this is her world as well. And that is, one of the anticipated impacts at the AAMC sees is that we may start seeing a decrease in applicants choosing medical schools in these particular states that have anti-DEI laws, and especially our Indigenous students, because of what's important to them. And more specifically, it may be what we're seeing in some of the other states that have banned these DEI offices. This includes elimination of recruitment practices like things that we do, outreach, pathway programs, second look visits, that sort of piece, and also decrease in financial aid and scholarships, of which many of the students that we work with actually need, sort of thing. But we have to also remember there are accreditation standards that are in place, at least in medical school, and I know in nursing, PA schools, and some of the other health profession schools, they also have that as well. And so I'm not going to go into a lot of this, but there are some evidence in the LC elements, such as 3.3 for admissions as well. And we'll get to that, and we'll get to the basic answers after this. So thank you for your questions. The second piece is curriculum as well, because due to the censorship that is happening in some of these states, I'm thinking Texas and Florida, and the lack of funding resources, again, we also have to anticipate, will there be a decreased elimination of these courses addressing biases, structural racism, discrimination, and health disparities? Will it impact our ability to do more community engagement with the communities that we care for? And also, will it have any impact with our service learning opportunities? But understanding that we do have standards in our particular medical school accreditation bodies that are listed here that, again, may impact that the legislators probably don't know. My biggest fear is this, and that's the attrition of Indigenous faculty, because they serve as our mentors, they serve as our role models, and also our student advocates as well. But we even have an accreditation standard for that in medical school as well. That's listed there for you too. What about graduate medical education or residency programs? Well, a couple things that are really important along this line as well is that we also worry about their application. Will there be a decrease in medical students choosing to apply to or attend residency programs located in the states with anti-DEI laws, especially, again, our Indigenous students? The important piece about this as well, we already have coming out next week is going to be something from our Research and Action Institute at the AAMC that they basically looked at, even after the Dobbs decision, ultimately, that we have started to see a decrease in the number of students that want to apply to OBGYN programs that are avoiding these particular states that have strong anti-abortion laws or other strong anti-women reproductive rights laws as well too. So I think more to come, and again, we hope we need to track this to kind of see what impact that may have. Also in residency, again, it may also impact the decrease or elimination of training on addressing biases, structural racism, discrimination, as I mentioned before. But again, there are some clear requirements for the clinical learning educational requirements that they're held to, and that's number 5, 6, and 7. If you don't do GME work, that work on this, and this is about essentially requirements that residents have to learn about healthcare quality pathways. They have to really study health disparities, and something in their training also has to also provide training around achieving health equity in healthcare along population health as well. And again, the attrition of our Indigenous faculty also will basically be impacted by this, as I mentioned, for medical students, but also for residents. When I start looking at the states in Florida and Texas, and these are some of the things just to kind of keep in mind, because we started to see in these 5 bullets these following scenarios as far as the attrition of our faculty. Some stay in the state, they don't change. Some stay in the state, but they leave their DEI work because now it's been banned, and they continue as faculty in their specialty. Some stay in the state, but they leave academic medicine totally, and they work only locally in their specialty. Some leave the state because they want to continue the DEI work and work in a DEI-friendly state. Some will leave the state, leave academic medicine, still work in another state. But also hiring with regards to faculty. Ultimately, they may avoid applying for positions in these states, unless like medical students and residents decide not to go to the program. Or we may have some faculty decide, I'm not even going to apply to this when you're essentially advertising the institution for that. And it brings up the concern about brain drain as well. So we may find this not only, as we've talked about brain drain from overseas, but also brain drain domestically with regards to that. And that's an important thing we have to think about as well. We've been talking about anti-DEI laws, but I want to just put this in the back of your brain to think about, because as I mentioned, there's now 22 states that have had abortion policies in effect as of December of 2023, and it's growing. And the reality is those that have the most restrictive ones that are highlighted in the dark brown that's there, again, may have an impact about where residents decide to stay, because remember, residency is probably the best predictor of where people stay. Data has shown that about 65% of them will stay within a 50-mile radius of where they did the residency. That becomes really important for some of our states and some of our communities as well. Again, there's also shield laws for those who decide that they want to do our abortion providers that really protect them with these shield laws. And there's 22 states, including the District of Columbia, it's not a state, that already have either a statute or an executive order that really protects those providers, but also protects some of the patients as well from going outside. And let's not forget about our particulars, medical students and residents and faculty who want to learn about, but also continue about gender affirming care, and also LGBTQ rights as well too, because that may have an impact on who stays, who leaves, and who decides to go to these particular states. So again, it's complex, it's contemplated, it's complicated. But again, we have to consider all of these sorts of things in raising our voices about the concerns that some of this legislation is going to do. And I'll finish up with 2 legislations that have come up at the federal level that becomes really important. And the EDUCATE Act, and some of you may know, it stands for Embracing Anti-Discrimination, Unbiased Curriculum, and Advancing Truth in Education. That was basically proposed in March of 1924. And it still hasn't been looked at or passed yet. It's being evaluated right now. And this particular EDUCATE Act, ran by Dr. Dr. Murphy, who's a urologist in North Carolina, basically looks to amend the Higher Education Act of 1965 and actually move beyond it to say, we want this act to prohibit graduate medical schools from receiving any federal funding if they adopt policies and requirements related to DEI. But also the other piece that really infects us is that they want to require, if this law is passed, they want to require accreditation agencies and associations to demonstrate to the Secretary of the Department of Education that they do not require an institution or program to adopt any policies as a condition of receiving accreditation. The good news is Joyce Beatty, who is essentially a congresswoman that represents Ohio. She's a co-chair of the Congressional Black Caucus DEI Task Force, and also Congresswoman Castor, who's the co-chair of the Congressional Academic Medicine Caucus on the Hill, introduced the resolution as of May 1, 2024, recognizing the importance of DEI work in medical education and really affirms the need for a healthcare workforce that mirrors the nation's diverse populations and to advance health equity throughout the United States and and the need for us to continue to support DEI programs and academic freedom in our institutions as well. So that's a lot. I apologize, but again, like I said, I'll give you the slides to take a look at as well, to look to inform you. And again, I'm always available to you to think about, how can we basically help? How can the WMC help along this line as well? And even some of our senior faculty who are involved in some of this may also know how to help in this point. So what I want to do is leave you with this last quote, as I mentioned, because again, it gives me a really, when I think about at the end of the day, despite the landscape that we're facing and what I just presented to you, we need to remind ourselves and each other, we need to remind each other of why we all keep doing the work that we keep doing. And I think this last quote really touches on that thought, that on the days that it's tough, know that you're impacting millions of people's lives, including our patients, not just our students and not just our residents and faculty, and helping to change and create a new future in what we're doing. So I'm going to go ahead and stop sharing my slides. I'll stop there and give it back to LeeAnna.
Thank you, David. That was really informative and actually very powerful. And for somebody who works in this space, as I said earlier, very intensively and on a daily basis, it's always helpful to stop and pause and take a, sort of get the pulse of what's happening in the greater, sort of communities around us, and then to be able to pause and reflect on how is that impacting those folks in my community personally, in my academic space, and in the workforce that I so strongly and passionately desire to do what the Congresswoman has said in that legislation of having a healthcare workforce that reflects the diversity of our country, and that is specifically critical in our Indigenous communities. So I really appreciate that, and I think our audience really appreciates that, that snapshot into what's happening in our time and space today, because we're all here representing different programming, representing different parts of the ecosystem, and wanting to come together to create, a stronger ecosystem. And so having this knowledge is actually, power that we can take back to our communities and really reflect on that. So I appreciate that. And then what I was thinking as I was listening is we do have some history, we go back a ways, and it feels like there have often been times in our careers where we've come up against, sort of folks who have very different perspective and want to, sort of prescribe how and what should be in our medical education systems, our health professions education systems. So I'm wondering if you might share a little bit of perspective of how you've seen or experienced changes in support for DEI work in the past, how you've managed, sort of that you could share with our audience, that they may be able to take some of those tools back to their communities.
I think the lessons that I've learned in working in both Washington State and California is a couple of things that I'll share with you. And that is, I've changed my anger into action, if that makes sense. Because what I've learned is that, again, in doing work that we do in this space, the reality, we always talk about understanding the perspective of the other and really taking the time to listen. And that's been probably one of the hardest things about my job, because again, of my particular perspectives, my bias opinions of myself as well. But I think it's what I've even done, even the last several years, is really try to understand the perspective of the people that are naysayers for DEI and don't see the value or take the time to really look at the evidence and how far we have come. We certainly aren't there, but how far we have come over the last 20 years or so, and really try to understand the perspective of, this is about health equity. This is about providing, bringing folks to the table that are going to take care of our tribal communities, that are going to take care of our under-resourced, underserved communities as well. And how can this be a bad thing? This is about humanity as well, about caring about everybody that walks through my door. And that's always been a really hard wrap behind me. But it's also really important. I think what I've learned is trying to understand why people believe the way they do. And this has been generational. This is things that have been passed down from one generation to the next. Especially when we talk about things such as white supremacy and what that means and how that even develops, sort of thing. But all of that also impacts that. How this whole notion about being anti-education, and I start seeing the lower numbers I was just reviewing this morning about students that are not enrolling in an undergraduate education. Not talking about medical school now, but the numbers are going down than from where we were and how much time because I think students are smart. And they basically are saying, if people don't want me there, maybe I need to look at something else to do, sort of thing. And that's very real. Sort of thing. I think the second piece about it is that, and that's why I talk about don't overinterpret the law, because when I first got to the UW and I was at the admissions committee, I was really surprised that after I read that law, that how much the admissions committee was following the lead of that particular chair at that time, not you, but predecessors way before you when I got there, about how the anti-affirmative action law in California, in Washington State, was being interpreted. It was interpreted wrong. And so one of the things that I learned is I went up to the School of Law at the university. The admissions dean at that time was a first generation Latina, and they were doing great work at that time. But actually asking her to come down and to address, our admissions committee and the dean together, saying, what do we need to know about this law? And she did a wonderful small workshop that said, well, what do you think the law says? And what was amazing, she was a myth buster. She addressed their assumptions and really put it straight about what we could do within the law, what we could not do as well. And that changed everything with regards to that. And it really kind of stymied some of the assumptions that were made as well. And so I think it is important. The other thing I think is important is that we were in a very white state, rural state. Half of Washington was rural. But we also were the only medical school at that time to 5 different states as well. And so one of the things that we also felt is that people didn't know anything about Seattle. They only knew, they didn't even know about the Pacific Northwest. It was such an enigma to them, sort of thing. But to try to get students to come to that particular school, I think one of the things we had to do, when I say we have to do new innovative models, at that time, University of Washington was very complacent, saying, well, we're the University of Washington. We don't have to do anything. We're the UW. People want to come to us. We turn people away. But it was that mindset we had to change in the sense that if we really, really, really wanted to keep admitting the same students that we were admitting, which was very low with regards to URIM students, including our Indigenous students, then, let's keep doing the same thing. But the reality is that we had to really kind of, I used the theme. I remember one of my movies that came to mind was The Field of Dreams. Remember where the movie theme was about if you build it, they will come. And so we started looking at our curriculum and decided to help build these pathways. Already in place was the Native American, the Indian Health Pathway that was part of our Native American Center of Excellence. But we use that as a model. How do we expand that? How do we create other pathways using that same successful model to get students to come because they were looking for institutions that were really going to cater to what their desires were, what they wanted to learn, and the people they wanted to serve. And that was really instrumental being able to do that. And we were able to secure a grant from NIH to be able to do that and create even more pathways along that line, but still remaining very true to that. We even created more opportunities, created more elective courses, any particular courses that had to do with, let's say, OB or internal medicine. We wanted to make sure that they could do some of those rotations at peripheral sites outside of Seattle, where they would be exposed to the populations that they wanted to take care of. But they were also being taught by, again, those faculty members that came from those communities or communities like them, being taught, what are the nuances we need to know when you take care of these particular folks as well. So, I think it's about a matter about, being really intentional, coming to where the students are and what they need. And there's no question the new students that are coming in, again, I was always kid with you, Lee, and I would never get into medical school today, looking at all the things that they've accomplished, right? And all the interests that they have, because they already know about the ills there. They're just really frustrated with us about not creating those opportunities. So, I think I should give a big shout out to the U of W of maintaining a lot of that work, and especially I think about the indigenous pathways that you've created and opportunities for students to work, in those particular tribal communities, which makes the biggest difference.
Yeah, and I appreciate all of the groundwork that was laid far long before I came on board to be part of that community. But I will also say that as we've faced challenges of funding for such programs, and I think that's often the challenge for the folks on this, in this session today, is that a lot of this is dependent on somebody else funding it. And, it's on a shoestring budget that if for whatever reason the administration changes or somebody decides you don't meet the needs or requirements any longer, the funding can often go away. So we've at UW, we've actually taken a little bit of a different strategy of late in terms of supporting our Indigenous community. And while still going to the legislative body, it's more on a tribal and statewide sort of tactic of not looking for federal funding or foundation funding that's kind of what we call soft money, but really having the folks who are invested in our workforce make a commitment that's real. So in the past 2 years, we've had folks at the UW who worked really hard with local state legislative bodies and the tribal communities who came together and said, this is important to our tribal nations for us to have healthcare providers that are from our communities that have the expertise and training that will come back. And we were able to secure funding for our Center for Indigenous Health that has now stood up as of July of this past July, and really designed to help support our students and our faculty and research within our tribal communities. And it's funding that's in perpetuity from the state legislature of the state of Washington to support that with, sort of input from our tribal nations. And so that's an approach that our school took because we had some, very successful programming, particularly while you were around that. But it was, sort of based on some funding that you had to reapply for, and you weren't always, sort of in the competitive loop. So we've taken a different approach and really gone to the tribes. But it required building relationships and having them understand sort of what is the impact and what are we looking for and what are the problems we try to solve. In return, we're sending our medical students to those communities to learn and to mentor. And so it's a relationship building that I think will bear fruit. And it's part of that ecosystem building that I've spoken about a lot in terms of there's so many parts to it, and we need all of them to be participating and to be strengthened along the way. So appreciate, sort of that. So that is kind of some of the strategies. I'm wondering if you have advice for folks who are trying to currently stand up a program, like in the face of this anti kind of DEI legislation. If you're just new and starting a program, some sort of pathway program or something to support our Indigenous students, is there any advice? You've hit on a lot of the topics of like, get good legal counsel, go local because it matters. And it can vary from, state to state, but are there any other pearls in the last maybe 2 minutes, and then we'll kind of open it up for more Q&A?
Yeah, again, I think Washington State has a wonderful model because keeping it local, keep it within the state has to commit to this. If this is important to them of diversifying the workforce, and clearly we know the workforce is changing and the demographics are changing dramatically. And what hasn't changed is the health inequities and the health disparities that they're being sustained in a lot of areas. If we learned anything from the COVID pandemic, is that the communities that we care most about suffered the most. And so I think we need to keep harping on that. I think that's the most important piece of it. The second thing I'll say is that, what I've learned from the AAMC a lot is that, in working with what legislators want to hear, they don't want to hear about our data. as much as what they want to hear is they want to hear stories from the people that vote for them. And so what's really critical is that,
PRC referral.
how do you leverage that power that we really have, and sometimes we don't recognize. Because I think that's, again, our communities need to rise. You need to help raise their voices in the sense of why diversity matters, why a diverse workforce, why Indigenous physicians, nurses, and all the health professions and allied health professions make a difference in the care that they receive, in how they are listened and how they're respected and how they get the care and access to the care they need. We need stories, we'll provide the data, the quantitative data for that. But the important is that qualitative piece that again, how do we work with lobbyists? How do we work with people that inform, our state legislators, even as they come to the Hill and DC, those stories are going to make a difference, and they keep asking us for that. Even faculty that are doing this, I came from this particular community. I would have never made it unless I had this particular office that helped me get through medical school, get into residency, helped me through that as well. They're instrumental, on and on and on, because now I think about our graduates, we're now practicing out there, right? And the reality is some of them are even in leadership positions as well. So we need their stories as well, because I got to tell you what I've learned from being at the AAMC, as I was mentioning, is that I was uniquely surprised about how our legislators don't even know what DEI means, what an Indigenous program means. They don't know what we're doing. Despite as many times as we try to publish the wonderful things that we do and try to showcase that, they're not paying attention, because that's not necessarily the communique that they are tagged into. So I think it starts at the local level, the local legislators level, as well as the state level, is that they need to be educated. They need to have the data in front of them. They need to know what's the narrative that you want me to carry to DC when I get there and I face Congress or the Senate, sort of a thing. And I think it's through that storytelling that's going to be most important. And that's where our communications offices come up. Again, we may not be able to put that and translate that into the narrative that people will listen to, but we have experts in every one of our institutions that knows about that narrative and how to create those communications. But yet it's got to be the leadership that's involved that says, this is important, and also prioritize that with those particular communications and marketing affairs that are important. And I think the last thing that's really important is, how do you work with your representatives? The AAMC's got representatives in the government relations offices at every medical school in the United States, and teaching us, and essentially what they can do is they can teach us of how to create these narratives, how to write letters to our congressmen, to our legislators as well, how to get involved, how to get to sit in front of them, to spend 5 to 10 minutes to show them about what the big differences is. And the last piece I'll say as well is, we need our schools also who are running we have a philanthropic arm. They usually are there to raise money for buildings and those sorts of things. We need them as well to bring to the table. When I say we usually have depended on the usual suspects for funding, we got to go outside of that range, because again, there's a lot of donors out there that are looking for causes to donate to, but we just don't hear about them. And we need basically to see, how can we collectively have come together about those particular key stakeholders that we need to pay attention to. May not even be, Native American, but the important piece about this, but they have that passion of wanting to make a difference with their money that they support. And there's other foundations that we probably don't use very much, like the STEM. I'm thinking about the Sloan Foundation as one example. Again, there's a lot of money out there, and the grant writing is not as rigorous as some of it is for NIH or writing for some of these other larger grants, but they're looking for those causes. So again, maybe another session that the iHeart Summit can have is basically bringing some of those philanthropic leaders to the table to saying, what do you want to hear from us? What are you going to pay for? How can we put this into action for you? So.
Yeah, I so appreciate that. Sort of all of those pieces are super important. I think I would also add that for there to be impact and an effective, what I've observed in things being effective is also developing the relationships with the tribal communities and getting, sort of having your tribal communities on the local level really, sort of understand the critical need. They experience it on a day-to-day basis from the status of their health and the wellness in the communities, and they can see it, but not understanding all of the barriers that lead to, the high level of vacancy, within our IHS and tribal facilities. What are some of the things that influence that? Well, the barriers that are put in place for our students to get, sort of to the training that is needed. So really partnering also, not only learning the ways of the legislative process in the world and the advocacy on the national and state level of advocacy, but also including your tribal nations, your tribal citizens, the tribal leadership to engage in those conversations, because they're looking for ways to improve their communities. And this is critical in terms of the health and well-being of their citizens. So I think developing those partnerships and using that allied, using an alliance of tribal leadership that already has some of those relationships as well. So there's the educational sort of component, but it really is about how it affects communities. So really appreciate sort of having both of those perspectives. It seems we've come to the top of the hour, which is, sort of depletes all of the time we were allotted. I've been advised we perhaps have time for one question. I know that there were some questions in the chat, and I appreciate Dr. Bray for jumping in and answering some of those, and other folks who've had conversation. Dr. Williams, if you have a brief question, because I've been given authority to continue for about 1.5 more minutes. Otherwise, we could certainly take it offline as well.
No, I just wanted to bring his attention. Hi, Dr. Acosta, how are you? I think I saw you at Elena's meeting, Dr. Rios' meeting, not too long ago. But anyways, I wanted to bring the attention, the implicit bias of these congressional leaders and their conservativeness. And that's one of the areas, the testing areas that one goes through during leadership training, for example, and often people have not exposed themselves to that because they've never gone to leadership training. So that's one of the things I wanted to bring the attention. The second thing is, has there been a discussion? I remember there was some about bringing the attention of the treaty rights in relationship to education and healthcare when speaking to these legislators who are anti-DEI, for example. Has AAMC utilized that argument? So that's the question.
Go ahead, LeeAnna, if you want to go first. So the AAMC is very aware of it, but we find ourselves, who we work mostly with is that how many our admissions deans and admissions officers don't know about them. And despite a lot of the things that we've worked very closely with AAIP in trying to fashion this, and despite our documentation, sometimes that's just not read, and it's almost, we find ourselves repeating ourselves over and over and over again. In my mind, what I don't know would be really interesting to study is how many in onboarding admissions committees do they really cover that, right? Because we have, again, a lot of folks who don't have a knowledge foundation about that at all. And are really surprised when they hear about it or they're taught that. I think about, I remember Mary Owens and I and Norma have had discussions about this in the past as well. And again, about how limited, you would think that if I'm in a particular state that is really catering to a lot of Indigenous students that are coming in, that you'd pay attention to that you do a deeper dive on it. But not surprisingly, like anything else, sometimes in academia, we have to continue to be outspoken until we're heard. LeeAnna, thoughts on that?
I agree. And I guess I would just say that for those of us who are, part of the, sort of development of our workforce in whatever fashion that is, if you're not aware of how tribal communities are impacted by some of the anti-DEI, and particularly like the SCOTUS decision around college admissions, please, we can even I could provide some resources. The AAMC has some great resources that really talk about, remember, tribal citizenship is a political designation, not a racial classification, which is really what those decisions were based on, what much of the DEI, sort of work is. And so we do have that in terms of protection. And so we want to ensure that people have that awareness. But at the same time, you're going to come up into the face of people who don't understand that and will, sort of, that is our responsibility, I think, as folks who are championing this work, is to be that voice and to amplify, sort of that message, and to protect our tribal citizens and our tribal nations at every cost. And I've seen a lot of the comments, and I definitely agree with much of what has been said. It can be used to weaponize, and we have to be careful. But at the same time, if we're not talking about it, obviously nobody else is. So at this time, I just want to say thank you, David. It's been a pleasure to chat with you today. As always, a mentor and a leader in the institution. When I was, we talked about that dean that you were educating. That's the dean that let me into medical school. So I have to be thankful to him, but totally understand that. So I've appreciated our time together. Thank you to the audience. Thank you for letting us go over. I think this is such a critical sort of topic that we wanted to get all of the information in. So I appreciate the opportunity and the time.
Thanks, everybody.